So good afternoon, and glad you can join us for this session on financing a national pandemic preparedness strategy for future pandemics, the role of public-private partnership, or PPP for short. I am Dr. Millicent deGraft-Johsnon, and I'll be your moderator for this session. The Accra SDGs Investment Fair, the third in the series, is brought to us by the Ministry of Finance, the Ghana Investment Promotion Center, and the SDG Advisory Unit at the Presidency. The goal of the fair, among others, is to provide a platform for discussions on how the private sector can partner with government to meet the deadline of the SDGs. And this year's theme is dubbed the Decade of Action, Accelerating Recovery and Revitalization. As we've observed all around us, the pandemic has shrunk public finances of most countries, with governments struggling to respond to health crisis, alongside increased funding of social intervention programs, business relief, as well as measures to reduce and combat the spread of the virus. Financing recovery would therefore require government seeking private sector support in infrastructure delivery, as well as attracting private sector participation and funding to reduce the already stretched public finances. In essence, we know that pandemics pose a serious threat, not only to global health security, but also to economic security and to our ability to end extreme poverty and achieve the SDGs. While pandemics are inevitable, pandemics, if addressed early, are for the most part preventable. The question then is, how do we prepare for future pandemics? And more so, how do we finance such a strategy? This afternoon, I'm glad to have with me experts in their respective field to help us understand, digest, and delve deeper into this topic. So let me quickly introduce my distinguished panel members. To start off with the only female on the panel, we have with us Madam Irene Addo-Dankwah, Head of the Public-Private Partnership Units of the Ministry of Finance. And she has been working on this schedule since 2017 and was key on drafting the PPP Act, which was passed on December 2020. Madam Irene, you are most welcome.
Thank you, Dr. Millicent.
Okay. Next, we have Mr. Seth Twum-Akwaboah, Chief Executive Officer of the Association of Ghana Industry. Sir, you're most welcome.
Thank you. Thank you for having me.
So we also have with us Dr. Hafeez, Head of External Health Corporation with the Ministry of Health, to help us address this topic. Doc, you're most welcome.
Thank you very much.
Okay, so to kickstart, I'll allow Madam Irene to share with us her perspectives on the topic for discussion. Madam Irene, you have 5 minutes. Please go ahead.
Thank you, Doc. Okay, on the topic, we have the role of PPPs, that's a public-private partnership. From our end, we see the public-private partnership as a means that governments can use in procuring infrastructure and services generally. It is a good tool in the sense that it will enable governments go around, their resource constraints that most of them are faced with, and then the fiscal space limitations that they have. And it's basically about leveraging on the resources, the skills, and the financing and the capacity and knowledge of the private sector. That's summary what PPPs is all about. So you will need to have an effective program to be able to tap into this resource that the private sector has. There's a lot of innovation out there in the private sector, more than the public sector. So that led us to having the Public-Private Partnership 2020 Act 1039, just to enable us tap, appropriately and effectively into that space. Coming into being of the Act 1039, it signals the private sector that now we are serious with partnership with them. It will enable them know what the process entails when it comes to Ghana's PPP space and what we can take. What they offer, the offers are many depending on the country that you come from. But in Ghana, we have a lot of things that we have to look out for just to be sure that it's on a sustainable path. PPPs, even though they are good, they have some downsides. If it doesn't work, especially if we had signed up something just before the pandemic, what it meant was that there wasn't going to be revenues, and so it means government would have to absorb all the contingent liability. So we have to watch out for all those things.
Okay.
Fortunately, our bill has, our act has, taken into considerations all these limitations and found out, the right space that we can operate in when it comes to Ghana's PPP space. Yeah, the program. So in essence, that's what I'll say, that it's a good mechanism. We can look at it within our, constraints that we find ourselves and do what is expected and get the best that we need. Thank you.
Thank you, Madam Irene. Okay, so we'll have the private sector view as well. So, Seth, please share with us your perspective on the topic.
Thank you very much. I think that it is an interesting topic, and indeed, the private sector was actively involved in the development of the PPP, and therefore, if it's going to be used for such an important agenda as funding pandemic, I think it's in the right order. And indeed, the idea of preparing for pandemic or future pandemic is very important, and it's in order, especially so because you cannot prevent the occurrence of pandemics, but you can lessen the effects if the pandemic occurs. And the way you can lessen it is actually prepare in advance. And the COVID-19 taught us a big lesson, that we really needed to prepare so that we reduce the negative consequences of such pandemic. Indeed, for businesses, about 80% of them were affected by the pandemic, as by the AGI's own survey. And in such situations, there are different areas of expenditure that is critical, and you need the private sector to come in. Healthcare infrastructure relating to health centers, medical equipment, medicines, and even the human resource area, doctors, nurses, and all that are important. Apart from those direct ones that relate to the healthcare, there is also the food security aspect. Shelter, sensitive installations all have to be protected. And there's so the issue of business disruptions can also be very fatal if it is not well managed. And we also saw how the COVID situation happened. So definitely prepare in advance. And all these areas that I've mentioned really requires a lot of investment, a lot of resources to do it. And when it happens, mobilizing all the resources to handle all these within that short period could be very, very challenging. And it is therefore important that we prepare in advance. Now, prepare in advance means that you must have possibly the resources in place to handle it. And it is also not easy to mobilize resources in advance for something that hasn't occurred, especially when you're dealing with a country that also has serious resource constraints. So I can understand the difficulty, but then the best way to handle it is to prepare. And therefore, some measures could be taken to help prepare in advance. I think as we gradually and progressively improve our health facilities across the country, it's also another way of preparing. If you have good structures on the ground, when a situation of that nature happens, because you already have some structures on the ground, it becomes easier to contain it. I think that for private sector, we always also think ahead, and therefore it may be important to establish what I may call the National Pandemic Fund. If you have such a National Pandemic Fund and you have a stream of income that is reliable. So for example, I'm just giving this as an example, but we can explore other areas. For example, if you take the National Health Insurance Levy and you say 0.5% should go into that, that becomes a fund that is being set up along the lines of the Heritage Fund, and then it's permanently there. Whatever you're able to accumulate within a certain period, you invest, and then you continue to multiply. If pandemic hasn't happened, all the better, but that resource is there for future use. I think it's very important that we have a fund of that nature. And you remember in the COVID period, how the private sector readily came in to support. And as part of the PPP, private sector can come in voluntarily to contribute, but let's have it in a structured manner by giving some incentives. It could be tax arrangement that we could use. It could be government procurement arrangement and all that. That encourages the private sector to contribute to such a fund. I think that would be very important. And the PPP, we could always have, proposals that we invite, that solicited proposals or unsolicited proposals. So inviting the private sector to bring some proposals and ideas and innovation into this will be great. If we extend this opportunity to private sector, I'm sure ideas will come up as to how we mobilize the resources to do it. What private sector always wants is a kind of security that if I put in this investment, I have, and it's something like something sensitive as pandemic, you cannot be able to plan ahead. And therefore, if I put in investment that is going to take so long to mature, there's political instability, there is a change in government, how is it not going to affect the investment I've put in? So the PPP structures, I believe, handles this. And therefore, it is a very good platform to use in promoting preparedness of this nature. I think that the private sector can support in a great way in preparing for financing of pandemic in the future. Thank you.
Thank you very much. So we'll also hear from Doc, Dr. Hafeez. Please, you have the floor.
Well, okay, thank you very much. And first of all, let me commend the initiators of this wonderful initiative. I think it's a laudable idea. It has been long overdue. And just like every building or every structure requires a solid foundation, I think with PPP, it becomes a solid foundation for us to be able to start going again after the incident or just as we live within the pandemic. Now, the economists have indicated that in 2020 alone, a slowdown growth between 3.4 to 4%, or 4.2%. And so for us in the health sector, it means a lot for us. It means a lot because I will be biased here by equating, the process and our growth to the human body. God has been so crafty enough to have a full body made up of the head, the arms, the legs to be able to work together. And so that requires that we cannot, any sector, be it the financing sector or any other sector, cannot do it alone until we come together to harness our efforts and look at our strengths and weaknesses. And so earlier on, somebody mentioned in the area of health how we lost lives in the area of professionals in the health working area. And it means that we have to, it will take us a long while to be able to replace them. And so with the PPE, we need infrastructure, we also need equipment, we also need research. Because as we are experiencing now, the pandemic is not unique to Ghana. It's a global pandemic. And it requires that we must continuously follow the genomes of the pandemic, because it keeps changing. You realize that we're just going out of the third wave. What does it tell us? It means that we haven't yet prepared for it, because every now and then it changes. And as it changes, so will it have negative impact on our economy, impact on our health, impact on tourism, impact on agri, because you must be healthy enough to be able to sit down to do your economic analysis, financial analysis, and what have you. And without research and without the efforts made from the private partners to keep us at all levels, do all these things, I don't think we'll be able to meet the requirements and be able to fight to reduce the impact of the pandemic, to allow economic growth and all other sectors, including agri and tourism. And so for us, it comes handy that with the PPE, the initiative of the PPE, it will help us a lot in terms of looking at the areas that we are so weak. You realize that in recent times, we are faced with the problem of lack of bed syndrome in our hospital. It tells us that we have to expand our capacity. Infrastructure, if you have infrastructure without equipment, it means nothing, because you cannot work with just the building. And so it requires that we have to up our game in the, like I said earlier on, in research, particularly in the health, to be able to guarantee that we have a healthy nation, and healthy nation is a wealthy nation. And so my initial comments are that we are in for it. It's a laudable idea, and that we must make sure that we coordinate it well in order to benefit fully the good things that will come out of that. Thank you.
Thank you very much, Doc. Now, I have a few questions on the points that were raised. First to Irene and Doc, how do we leverage the private sector assets and capacity in the development of national plans for preparedness? I will start with Doc.
Okay, thank you very much. You see, and that is why sometimes we think that when we are drawing our national plan, we have the tendency of limiting it or restricting it instead of expanding instead of expanding our consultation. Because an economy will sit down and look at just the figures without extending it to look at what would be the impact in the health area. And so for him, he thinks that we are far away. You get me? Then we also set our corners and look at strictly, what health issues are, without, relating it to the economic and funding aspect of it. And that's where the problem is.
Okay, so on the questions of discussions, Doc, how do we leverage private sector assets and capacities in the development of national plans for preparedness?
Well, one way that we can do that is to be able to expand our consultation during our planning session. In most of the cases, we work in silos, and that does not cover many other areas that could have expanded the benefits that we could accrue from the private partnership, facilities. So for me, I think that during our planning, we should do well to expand our consultation. Consulting and knowing other areas that are directly related or indirectly related will enhance our capacity in making sure that we deepen the benefits of private partnership and then also capacity building. In most of the cases, if we do it in an isolating manner, it limits the scope of benefit and the advantages that we could get if we expanded our consultation during planning. One other area is the you know, when we open up and we are able to create a platform where we can capture inputs of other sectors, even though in some cases you may see them being far away from what you do or your core mandate. If you invite, input from sectors such as the health, agri, and related institutions or agencies, you will eventually see that there are gaps that you can fill in order to enhance the benefit that we will get from private partnership. Again, I want to believe that at the Ministry of Finance, you have a desk where you look at other areas, including health. In all what you are doing and you're planning, how do you capture, apart from just the budgetary, beyond the budgetary, documents that we present to you, what other area and what other link do you have with the Ministry of Health in terms of knowing how will you be able to bring private partners to participate in the health sector, if it is funding, if it is in the area of engineering, if it is in the area of equipment, assessment of equipment, even in the area of procurement. How do you link us up? These are areas that are non-existent, I believe. And if we're able to do this, it will go a long way to enhance the relationship and also the benefit that we'll get from private partnership. Having said that, I know in our dealings and processes, we have tried as much as possible to invite private partners. One of the areas that I can attest to is our initiative of putting up a factory to produce biological larvicide, so that we'll be able to deal with malaria and other diseases that are transmitted by mosquitoes. And so building the factory, certainly our budget will not be able to cover that. And so we decided that we have to look out for private partners who can come in, put in money to be able to put up the factory. And at the end of the day, we start producing. And I tell you, this product has been sold to the ECOWAS region, the whole of ECOWAS region, and they have accepted it to be a strategic program for malaria and other disease control. So if we do this, it means that we're going to enhance and build up not just the health aspect, but the economic aspect of it, because we can sell the product to other countries, our neighboring countries, but they also have the same problem with the malaria incidents as well as the other diseases that I've mentioned. So things such as the example I've cited could be, we could have hundreds of them if we expanded, this consultation that I mentioned earlier on. Thank you.
Thank you very much, Irene. So Doc touched on consultation and collaboration. In your view, what are some of the things that we can leverage on in terms of the private sector assets and capacity?
I couldn't agree more with what Doc said. Consultation is indeed critical in the sense that in the past, what we have identified in our system, that is Ghana, is that we start a project, we have not done the due diligence, extensively, and in terms of the financing to complete the project. So we end up having it half, and we don't benefit, even though we have sunk some money into it. A typical example is what we had at the maternity ward, which is a public thing at Kumasi. It's been there for a very long time. But because we didn't have the right planning about these things, it stalls at some point, and then we lose out the money we have even initially invested in it. So consultation is great. That due to these things, not us losing money in terms of starting a project and not benefiting, and we don't have enough already. That gave us public investment asset division. We looked at it, and that's where we have based on the PFM, we have the what do I call the PIM regulations that is in LI 2411. That is enjoining all MDAs, MMDAs, SOEs to plan well. The planning entails appraising the projects that you want to do. You first start with, identifying the problem that you want to solve. And then you do a logical framework. So you are doing a thorough, thinking through the process so that you come out with the right option in terms of the solution. So we don't waste our monies, the few that we have, the small money that we have, on things that we cannot complete. So based on the PIP, we are going to have the program called the PIP, which is a public investment program that all MDAs are supposed to come on board and help us do that. In the PPP space, consultation is key. At every stage of the process, you have to consult with those who are working in the system already, those who are coming on board, those who will be affected by the project or the service to be delivered. So stakeholder engagement is key and broad. I mean, we need to do that to get the best out of what we put in all the time. To be able to, streamline this in our planning, the PIP, the PIMP regulations will take care of that. So all MDAs are being sensitized now. So from henceforth, 2022, the budget preparation that we are making, that's what we have done. We've sort of sensitized them a bit on what we expect them to do. And so that your programs are not in isolation from the others. It will all be in a system that we can easily pick and see who is doing what your impact will be on the other sector, so that we harness the best from what we put in terms of our efforts, finances and resources. So I think that would be the best way to say in terms of streamlining that, or integrating it into our national planning process, so that even if you are doing procuring it traditionally, there's a system in place to ensure that we have indeed thoroughly looked at what we want to do in terms of the problem that we want to solve, and then the solution that we are, advocating for is the best option at that moment, and then we go by that. So I think that will be the best solution now. Yeah.
Okay, all right, thank you very much. Now, Seth, there has been much talk on creating the enabling environment for increased PPP. Coming from the private sector, what do you think are some of the bottlenecks that hinder the smooth operation of businesses? And then what pragmatic measures would you offer government to help address these bottlenecks?
Great. I think that when it comes to measures to improve the business environment for PPP, may not be different from measures to improve the business environment for all other activities. Because for private sector, their capacity to deal with government and intervene and provide the necessary tools and innovations and activities depends very much on how well they perform their business. So the first thing is that there must be reasonable macroeconomic stability, because these are issues they don't have control over. If you have a business environment that is very turbulent and you can't plan anything, inflation levels are not within range, the CD exchange rates is always fluctuating, you can't plan anything, your business itself doesn't perform well. And therefore, when you are called to duty to finance a PPP project, you wouldn't have the necessary funding arrangement to be able to do so. Remember that private sector operates in different levels. Private sector business coming to support or partner government to do PPP investment in healthcare or for pandemic, they may also require finances. And that finance must come from, say, a financial institution. Financial institutions, in appraising whatever request you make, is going to look at your past records, look at the possibility of you being able to work with the money and pay back. And that all depends on the business environment. So the business environment in terms of macroeconomic stability is key. In addition, cost of doing business must also be such that it makes it competitive for businesses to thrive well. So if your cost of finance, for example, is so high, as has been talked about over the last few days, last week when AGR had its industry summit, and the senior advisor to the president was there. He talked about the spread between the policy rates and then the interest rates. That's a major challenge. So all these have to be looked at. Access to finance is very important. You need to have access to finance, and access to medium to long-term funding will help do, medium to long-term infrastructure. It's not just a short-term thing, because we're talking of pandemics. So you are preparing for something that hasn't happened. If you are talking of healthcare facilities across the country, in certain regions, certain districts, and it's to do with hospitals and facilities that you are investing so much money in, then it means that you must have reasonable access to medium to long-term funding to do so. Market access is important, because we are talking business. How do the businesses get access to good markets for whatever services they are providing? Sometimes partnership with government comes in here as well. When it comes to procurement, how can governments ensure that the private sector enterprises that they are partnering with will have a preferential arrangement for procurement? If it is made in Ghana, the items are made in Ghana, for example. How do we ensure that we place emphasis on government procurement or made in Ghana products that relates to the healthcare area? If it is medicine, why do we have to import when we can produce them locally? In fact, if you have manufacturing firms that are producing essential medicines, like the antiretroviral drugs and so many of these medicines that are likely to be needed in pandemic situation, it is very easy to go to them when there is pandemic and say, expand your operations, increase your volumes, because we have pandemic. But if they don't have the structures on the ground, how would they be able to do so when the pandemic happens? And therefore, it is very important that the planning is such that even at the very onset, government procurement is geared towards supporting private sector to be able to produce and supply and expand. I mean, when it comes to the production of vaccines, for example, you don't need any special machinery to do it. The existing structures in terms of manufacturing infrastructure is enough. It is a formulation, it is a licensing. Those are the things that you need to be able to produce. So if you have the structures on the ground, then these other things could be easily arranged. And then you have local manufacturers producing to supply government and supporting government when there is pandemic. We can use tax incentives and several other things to help encourage private sector for going into production of business that helps them. I think other colleague speakers have spoken a lot about consultation. I think consultation is key, because if you're able to do so, then the private sector can factor that into their planning. So the business environment, the plan, the consultation, and everything is important. One other thing that I would have to mention is that private sector wants security of investment. Mind you, they are borrowing, either they have their own funds, or they have other partners who are bringing in resources, or they are borrowing from a bank to do business. If I invest in something, how do I secure that investment? That in the next 5, 10 years, some of them are long-term in nature. How do I secure it? That in future, when there is a change in regime, a change in policy, a change in even individuals at the helm of affairs, it's not going to affect my steady flow of resources to be able to take care of the investment I've made. So it is very important that these matters are made clear, and there are structures within which it operates. And I believe the PPP law is giving a lot of information and incentives and policies around it, which for me is very important. Let's make sure that it happens. Now, you talked about how do we overcome some of these challenges so that it becomes even more attractive for the private sector to come in and partner government. I think those are the things I've mentioned. There's some effort towards it, but let's consolidate the gains we've made in terms of macroeconomic stability. Businesses will thrive. If businesses have excess money, they can go into all kinds of things. Also, let's also improve the general business environment regarding access to finance. And I think the model the government is developing for medium to long-term funding now is bringing in the development bank, which for me is very important. Those are sources that can fund big ticket projects. in the private sector. So private sector can tap into it and use it to also, intervene in healthcare delivery, especially when it comes to pandemic. We talked about the market. CFTA is here with us. We may think that CFTA is only with private sector people selling their goods outside and all that, but it relates to others because it's a market pool we are trying to create here. It gives opportunity for private sector business to expand. So if I have access to a large number of people, 1.2 billion people, and I can tap into that market, it enables me to expand as a private sector operator. So, and the bigger you are, the bigger your capacity to do things when it comes to emergency. So we should support private sector people, strategize well as a country, and tap into the CFTA market, as African market, and grow. Of course, whilst not losing sight of the other markets that are also around us. So I think that overall, reducing cost of doing business and making us competitive is key. The name of the game today is about competitiveness. If you are not competitive as a private sector operator, there is very little you can do because your market is being taken away on a daily basis. Even within the local market, you are losing it. So, for example, if you go to our pharmaceutical shops, what percentage of the drugs you have in our pharmaceutical shops are produced in Ghana? And is it because we are not competitive? If we are not, then let's deal with the issue of competitiveness. If we become very competitive, and then the large chunk of our medicines are produced by local people, it means that when it comes to emergency, we have adequate local capacity to produce these drugs for us. And not just drugs, but also some of the healthcare equipment. There are so many things that can be locally produced. And if you're unable to produce them competitively, we can't take the market. Others will infiltrate the market, they will take the market away, and then we cannot expand. So I'm looking at it from all these angles that has to do with proper business management and business performance. If we perform well, we can expand to other areas, and in emergency situation, private sector will be really ready to partner government and finance as expected.
Thank you very much. You touched on the incentive part. Before I ask you to elaborate on it, Irene, would you also want to touch on how we could incentivize the private sector-led solution? And then Seth, you can come in and elaborate on that as well. So Irene, how do we incentivize the private sector-led solution?
When it comes to the PPPs, we have two approaches. The solicited is the one that is coming from us as a public sector, requesting private sector to come on board. The other one is the unsolicited, where the private sector thinks they have something to offer, which we have not thought of. That is the public sector. So per the Act, it should be very innovative, whatever you are bringing, the proposal. So there's an incentive in there for you. If you bring something, then whichever sector you contact and they want whatever you have presented, they review and it's acceptable. The incentive is that because of value for money, because we are dealing with the public, we have to guard that. Even though there's some competition in there, we have the opportunity that we can source you in a way. If the sector that is delivering the project says they want to go with you, this particular firm or individual doing the proposal. So those incentives are there. Then since sometimes it's direct, how do I call it? Direct investments. You can also go under the JIPC Act to gain some benefits in terms of tax and some holidays when you come to operate in Ghana. So there are a few incentives in here that we can give to them to come on board. But when it comes to the PPP space, the Ghanaian private sector is not so much alive there. It's more of whatever we have done mostly is foreigners coming in to do their job. When they don't have the financing, then the expertise of whatever we want to do. Mostly, we've never, done that before. So the private sector here is not really interested in those things. So what we are thinking of is to reach out to them and tell them what we expect from them, because as much as possible, we don't want everything to go out, like everything that we do should be foreign people leading it if we want to partner with the private sector. So we have a provision for local content that whoever comes in, we should have some local content in. So we want our own people to also bring the private sector to bring something on board and be partners, not just as we are not limited. We don't want the sun and we are sourcing. No, we don't want that. We want you to partake in the equity so that you're also at the table, so that in case the foreigners want to go out, you have acquired some experience. At least if you don't have the skill now and you have the funds, equity level, you sit, you learn. So after some years, you can easily, the local people can just take over and be the ones in charge of it. So that's how we are approaching it now, to get everybody involved, because we don't want, it has come to our notice that if you are not smart about it, we'll end up all our big projects will be foreigners handling it. And it's a long-term, project, like 30 years, 25 years, and there'll be nobody in there. So we want them to be at least equity. So we want to make an appeal to them, which we are yet to have that meeting with them, so that our local people, so that they know that we are in, and whenever they see these things in the papers or anything, they respond appropriately, so that we make those concessions for them when they show for. So those are the kind of things that we are doing so that they come on board in terms of the local, but the international.
Before Seth, coming from the private sector, would allow Doc to also talk about the incentive bit, and then you can come in from the private perspective. Okay, so Doc, you can.
Yes, so my issue that I think there's no better incentive to a private at stake for him or her, because they are cardinal interest. I'm not saying 100% their interest is what they think to benefit from it, but certainly it is a huge incentive if a private partner who wants to participate with government initiatives will certainly be looking at what do I stand to gain in the first place before he puts in cent or peswa into it. And that's one. The other issue has to do with, I said, beyond the consultation, the other element has to do with how do we coordinate our activities after the consultation. You get it? So when you consult and then you get the input, if you don't have a structure to coordinate it, and that's why I couldn't agree more with the structures, that we need to set up structures. Yes, it requires us to have those structures and to make sure that after the consultation, we can run with all the inputs that we would have gotten from all other sectors and agencies to enrich whatever path we choose to take. And so it's very essential that we know that we need good structures, that when we consult and we get the inputs, then we'll now have a structure to coordinate all the inputs that we would have gotten to be able to run with those ones. So this is the other thing that I thought I should bring to our notice. Thank you.
Okay. Thank you very much. But we missed your first point. If you can just quickly mention.
Just what I was saying, was it the part of the incentives?
Yes, the first point that you made.
Yes, so the first part I was mentioning was that we're trying to identify which are the incentives that we want private partners to participate in whatever we are doing. And I was saying that, first of all, we must know that for a private partner to participate, the first thing that you'll be looking out for is what he stands to gain in whatever activities that he's going into, or collaborate with the government business. So we should be mindful of the fact that a private partner will not come in just for the sake of coming in. He will come in because he has something to gain. And if we don't make this public to them, and that's why I earlier on alluded to the fact that we need to create forum or fora. For instance, the Ministry of Health, we have a lot of projects that will require private participation. How do we, from the Ministry of Health, know that this private partner A or partner B will be interested in what we are doing. We don't have that forum. Or how will the private partner who wants to participate know that, oh, Ministry of Health has project A or project B that I'm interested in and I want to participate. For instance, we have a project where we are looking at acquiring a transfer of technology to stop amputation of diabetic ulcer, food ulcer patients. Because some countries have developed to the extent that they no more amputate. Yes, we are still going on yearly basis, not less than 200 people are amputated. Now we've identified that there's a technology to prevent, amputation, and that we can really stop the amputation by the use of this new technology. We don't have money to do that. Certainly, we have identified that project as being useful. Now, how will we know which private partner are we going to collaborate with to be able to acquire this technology? These are practical examples that I want to bring to the fore so that as we go on, we'll consider some of these things to be able to create forum. For instance, nothing stops probably Minister of Finance to identify some investors and say that, look, can we have a forum where we can engage Minister of Health to look at or explore opportunities that you can grab to be able to participate in their project? Something like that will yield dividends for our benefit and to the benefit of the nation. Thank you.
Okay. Thank you very much. Now, Seth, your take on the incentive bed.
Okay. So I think a lot has been said concerning incentives, but and by incentives is, for me, my understanding is that anything to encourage the private sector to go into investment of this nature and work with government and prepare for pandemics and healthcare and so on and so forth. But I think the first point that has also been overemphasized by others is about the consultation, and I'll add another angle, which is information and knowledge. Information about what is available, what is being procured, what government areas government is interested in. Irene mentioned the solicited proposal angle. So if there is a need to procure something and it is made available and is made known to the private sector, I'm sure they would like to take advantage of it. The timely delivery of such information is critical. If you wait to the last minute, most of our enterprises are SMEs. They may not have the capacity to step onto the plate when the notice is so short. So you may say it's a solicited proposal, so we are inviting companies to bid. Sometimes it's a whole innovation that has to be done. And the lead time for doing this could be so long that they may not be able to handle it. And that's probably why a lot of the projects go to the foreigners who probably have developed solutions already. So when they hear of it, they package it and bring it. So the timeliness of the information being made available to the local private sector is important. The other aspect is that it is not enough to be advertising these opportunities in the papers. Sometimes you must also engage private sector groupings like the AGIs, the pharmaceuticals. Within AGI, we have 23 different sectors of different business groupings. So if you engage us in the different areas that could be procured, we can bring our members, we can educate them. Even the PPP, a lot of them are not even aware of it. Of course, we've done some sensitization in the past as well, but it's been a long while, and I think the implementation it's now really beginning to take shape. So can we have seminars, information sharing programs that is educating people about all these opportunities? And when there's a specific procurement to be done through solicited proposals, we also engage the groupings and make them aware that during this period, this is likely to happen. In that case, it helps them to prepare and make them available to be contenders for such projects. You talked about the partnership with the private sector being largely foreign companies. And I share that view that it is also the perception that the private sector had in Ghana. How do we cure this? I think we should promote partnership within private sector to partner government. So it's partnership at the private sector level to also partner government. And the local content requirements may actually stipulate that for you to, if you're a foreigner in certain areas when you're going, you must have a private sector partnership. And they would make that effort to solicit partnership with the private sector. So at least we can learn from it, we can pick information, we can pick knowledge, we can pick resources, so that when similar opportunities are coming in the future, the private sector companies that is local, that has partnered the international company, will be in a position to even on its own apply for some of these opportunities. So these are all areas that's very important. When it comes to the incentives itself, incentive comes in different forms. All these are mentioned are part of ways of encouraging enterprises, but there could also be more specific incentives in the area of tax incentives, so that if it is that a certain percentage of your tax is waived, if you're able to supply certain essential products within a certain period, it helps a lot. I know that when it comes to importation of raw materials, for example, or raw materials for medicines, for example, is exempt. So something like that, it is good. But we can also look at other areas that gives further incentives in taxes to companies. Another area of incentive is also procurement itself. All that we are discussing, I know it's related to procurement, but there could be procurement incentives that gives the comfort to the private sector operator. He may be taking a long-term facility from a bank. Meanwhile, the nature of the project or the proposal that is coming is probably short-term, but it requires you to invest so much, which is long-term. How do I ensure that after the first supply, if government is the major procurer of that particular item, if it doesn't come again, what happened to the rest of my investment that I've put there, which your first tranche of procurement will not be able to give me the return on the investment? It may not even cover the cost of the investment. So a kind of steady procurement or arrangement that is also structured in the long term could be helpful. Sometimes we need to break the bulk. If the procurement volume is too high, we need to package it in a way that encourages local participation, and then make it such that when you break the bulk and it's even for a long-term period enough, it's constantly and steadily supplied. It encourages private sector also to go into such arrangements with government. And I believe that there's a lot that can be done with the PPP to encourage local content, local participation, local production, and support the government's agenda of creating jobs. I think that is, for me, at the end of the day, much as we are discussing about pandemics, we are discussing healthcare, we are also discussing development, and we are discussing job creation. And all these must work together to achieve the development that we want. Thank you.
Thank you very much. It's been a very interesting discussion. Lastly, on the National Pandemic Fund, Seth, you touched on it, the possibility of establishment of a contingency fund for emergencies. Any take on how such a facility will be funded from my three experts on how such a facility will be funded and how it will be managed? Just your take on it. So, Seth, would you want to set the ball roll on that point, how such a facility will be funded and managed? And then we'll come to Madam Irene and then Doc to conclude.
Okay, I think funding for such a fund, for me, I don't believe that only one source should provide a funding. It may be difficult considering the situation we have. But having a stream of income that is reliable, that is sure, would be great, even if it is not so much. That's why I mentioned, for example, we have the National Health Insurance Levy. Can we, tap into it, a small percentage, and it shouldn't be ad hoc, it should be consistent. So if it's a percentage, it means it's coming all the time. That's one way to support that funding. And then also, we could also have arrangements where certain percentage of our healthcare budget, the ministry can also make allocations regular, every budget. I know you may be laughing at this because you think that we have so many problems we're dealing with, but if you make it a policy that a certain fund should be made available every year to fund such program, it could go in there. The private sector can be brought on board as well. As we have discussed extensively, private sector need incentives. They need arrangements that is securing their investment and so on and so forth. And they can voluntarily give, private sector, they give a lot of corporate social responsibility funding to help in situations like this. Remember what happened during the COVID? AGI, we organized a lot of our members, and within a short period, we mobilized not just goods and products, but also financial resources. And we actually made such contributions. So many of them did it. So can we launch an arrangement where every year we encourage private sector to give corporate social responsibility, a certain budget to contribute to this? What I don't believe in is overly taxing people for such funding, because then it adds to the cost of doing business, it adds to the uncompetitiveness, it has other ripple effects. So some of the tax systems you already have, we can actually create something out of it. And then, and we can be innovative about it. Every year we can launch the fund, and bring other players in. We work with development partners. Can we direct some of the funding that comes from development partners into such a fund? And then grow the fund. You invest the fund when the pandemic hasn't happened. What we should also avoid is that once you have a fund, the tendency is for you to tap into it when you don't even need it. There hasn't been any pandemic, but you have created a fund. That's why I thought that contingency fund, call it a specific name like pandemic fund. If there's no pandemic, don't use it. Invest it. It's not to invest it. So that the future one is ready, you use it. Otherwise, in Ghana, everything can be contingency. And then
money is teachable.
Yes, then you go and use it, and then when the situation happens, you are found wanting. So I think different, of course, we can explore these areas further, but I'm sure there could be innovative ways of consistently providing such funds. I believe that any funding that doesn't have a constant funding stream will dry up at some point, and then it doesn't become very effective. So I think we should look at it. Thank you.
Okay, thank you. Irene.
Okay, I also lend my voice to what he said. I think the private sector will be a good source of channel to get funds into this proposed fund. But it will have to come with some incentive for them to come on board so that it's regular and sustainable part. Government is already, will definitely put in something, but because we are constrained with so many things, we'll do our part. I don't think we do, but I think the private sector will be more, if we incentivize them, will be more good in, contributing to this fund, so that because the pandemic doesn't affect just individuals. Look at what happened to us in March 2020 when the system was shut down. People lost jobs, and till this day, some people have not recovered from it. And it comes down to touch on everybody and the state at large. So if we put them at the forefront, I think, and with some incentive, they should be able to help us have something like, if it doesn't happen, as Seth said, we have not used it. But if it does happen, even the packages we are giving them to revitalize their businesses, we could still use those things to help sort some of these businesses out so that people don't lose out so much. So I think we could still, go around the table and think about how best to incentivize the private sector to take a lead on this one. And then definitely government will support it, and then we'll get other partners to help us with this kind of funding. It's very helpful, I think, so that we don't find ourselves in that same problem that we did in 2020. Yeah.
Yes, thank you very much. So, Doc, how to fund such an initiative, and then how to manage it? Your take on that.
Thank you very much. And again, I want to be a bit biased here. Already in the health area, we have been looking at some key areas that we think we could put on some amount of taxes on, and in that way we will be killing two birds with one stone. Come to think of smoking, the cigarettes. We try, and we have not yet succeeded in making sure that, of course, at certain level, the education has gone down well, and everybody who is smoking knows what he's inviting to himself or herself in terms of health. We know it brings about cancer. It can affect almost every organ in your body. And people still want to smoke. So why don't you prevent it in another way by slapping a certain tax on it, so that when you are smoking, you give us money to be able to treat if you get ill. So I am of the view that areas such as cigarettes, when people are importing, you can put tax on it to be able, and I know there's already a tax on it when they are importing, but you increase it, to a certain level. The extra tax you are putting on will always go to take care of what we are thinking of. Again, forgive me, alcohol is another area. So I know people, it's debatable and it's controversial, but nothing stops us from exploring the area of alcohol. Because you know how alcohol also benefits our liver and other organs if you drink it excessively. So why don't we look at these areas that have direct bearing on health to be able to put something marginal on it so that we can direct it towards what we are talking of. And for the management, I think that a number of accounts that you have isolated and you fence it to specifically direct it towards the purpose and the objective for which they have been set up. So if we do that and we get managers for it, of course, in doing that, if you get members of board that will not just be limited to maybe officials from the financing area, but also go beyond that, so that at least if you can't talk about the figures, you can talk about other related areas that could be beneficial to the management of it. So for me, I think that we do not go about, again, come to think of the environment. Now, what prevents us from making sure that people who throw about the rubbers and plastic this, we charge them, or you factor it into the price. If you come to buy, you have the option. In the shop, you should be able to have a paper bag and then a rubber bag. Now, if you choose to buy and take and use a rubber bag, there should be an element of cost to make sure that there's a recovery. When it is thrown away, we know the rubbers wouldn't digest. They are not biodegradable. And so when you throw it, not until they pick it up and look at the whole area is littered with that. Why don't we make sure that we, rather than creating problem with it, we create something beneficial by putting something on it, and even encourage people that, look, if you buy and then later on you bring back the rubber bag, you have something to benefit from. Why can't we do that? So these are areas that we can get experts to think around it and then think out of the box to be able to augment, the funding or the sources of funding that we are talking about. Thank you.
Thank you. Wonderful. Very insightful areas where we can source funds for this facility. All too soon, we have to end this very insightful session. And in wrapping up in a minute each, starting with the only female on the panel, your key takeaway or positive suggestion to governments. In a minute.
I'll say that the private sector is key now in the development agenda of every country, not just to give jobs or be in the productive sector, but they are key even in the infrastructure, the very infrastructure and service that government has to deliver to its citizenry. And so, as much as possible, we have to see them as key stakeholders in the development agenda, in terms of, consulting them on some of, or even inviting them for some ideas in solving some of the problems that we have at hand. I quite remember some time ago, we used to have, before the budget, we send out something for them to give us areas that they think we should, they come out with proposals. I think we should still continue with that and open it more further and deal with them in that, and so that we'll be able to harness the best out of the system for the benefit of all of us. I think that will be the best way now. Yeah, thank you.
Thank you. Seth, 1 minute, your key takeaway or policy suggestion in a minute.
Well, I think there's a lot that can happen. And as has been said, consultation is key. Ideas, putting ideas together is very important. And I believe that if we do so, we would definitely be helping private sector and leveraging their capacity to help solve such critical problems. The tax incentives, we talked about it, but I would say that it has to be explored further. It has to be seriously interrogated. I know Dr. Hafeez have mentioned a few things, but we need to go into the numbers. What even if you double or quadruple the tax on cigarettes, for example, how much money can you generate? So there's a whole lot of analysis that have to be done. Otherwise, you may be touching the wrong buttons. If you are thinking sustainability, you need to really think through properly and come out with a system that works, financing model that is reliable and sustainable along those lines. And I think that, the whole idea of the PPP for me is critical. Private sector can play a very critical role, but it has to be under structured arrangement that gives fairness to everybody, that gives puts a lot of emphasis on local content and local development. And then also, we can even use some of this as a way to grow our private sector and make them stronger so that they can also effectively participate in other PPPs in other countries. Because if you have an establishment that is strong, that is doing well, they stand a good chance of also actively participating in similar bids that are happening in other countries, just as others are coming to our turf. So I think if it is properly structured, but it can only be done when we do effective consultation with the private sector, and then we can develop everything together. I think solving pandemics is not an easy thing, something that hasn't happened and you can't plan. It happens, the scale it will take, you cannot tell. It's a very difficult area. However, the better you plan, or the more you plan, the better the results, and therefore the lesser the impact if it happens. And as we said, it affects everybody. Everybody could be a victim, and therefore let's all work together. And I believe we should be able to handle our own affairs when it comes to situations like this. Thank you.
Thank you. Doc, your 1 minute on the key takeaway or policy direction.
Thank you very much. If there's anything that we need to learn from the pandemic is collaboration. Strong collaboration among our private partners is key. It is something we cannot avoid because this pandemic has taught us this. Then broadening our consultation, as I said, is very key if we want to succeed. The second thing is structures. Because with all this, if you want to implement it, you should have a structure, a strong structure that you can base on to be able to implement all this. And the fourth, but not the least, is information dissemination, as I said, through setting up forum or fora for each side to know the strengths and weaknesses to be able to make good use of it. So for me, take away from here is broadening our consultation as one. Collaboration is key. Structures, to work with, we can't do without that. And then, as I said, information dissemination for us, because information is key. If you don't have information, then you have no knowledge. So, based on the information that will be available, then wise decisions can be taken. Thank you.
Wonderful. Addressing a pandemic is inevitable. But as it has been said, money and support delivered at the right time can help save lives and economies. It's been a pleasure talking to you all. Irene Addo-Dankwah from the Ministry of Finance, Seth Twum-Akwaboah, from AGI, and then Dr. Hafeez Adam from Ministry of Health. Thank you very much, but please don't go away. We have 30 minutes to engage with our online participants, so please stay and stay with us. Thank you.